Super. Wow, you look great. Wonderful, wonderful. Let's test because we cannot hear you. No, we cannot hear you. Inga Kovalevska, please help with microphones.
About now, can you hear me
Yes.
now?
Super.
Okay.
Yes.
All right. Perfect.
Okay, guys.
I was saying that the Lamaderm is doing well for me.
Oh, wow. Today I received an amazing photo of lady who's been using Lamaderm for 5 days only. Amazing result. I will show you later.
Oh,
So,
yes, I'd love to see it.
Yes, let's begin our conference call. So again, welcome everybody. This is a special call which we do for you to learn about the amazing product Lamanine. And Dr. ANDUJAR, who's a scientist, who's a researcher, will explain us why Lamanine, what studies he's done, and you will have chance to ask so many questions. And also, as I mentioned, we have special guest, my sponsor, Brian Smith, who will tell his story with Lamanine, how Lamanine just saved his life. Okay, Dr. ANDUJAR, let's begin with you, or maybe with me. Let me tell everybody why I really love this product, Lamanine. And maybe because in my family, I have amazing story. Let me start with my story to make sense everything what gonna happen tonight in this room. This is picture of my father. For new people, if it's shocking pictures, you can close your eyes. So in 2011, when I learned about Lamanine, from my friend Brian Smith, my papa was dying. That's his picture after heart attack. He had cancer, diabetes, uncontrollable sugar, uncontrollable blood pressure. I put him on Lamanine back in November 2011, and you can see his result. My papa is still alive, he's playing chess, he's going to casino, so I'm very pleased with his results. And also many people from different countries start to send me their results. And we posted many results with Lamanine on their diabetes and their blood sugar to YouTube, and I will show you where to find them. So yes, diabetes is a very bad disease. It leads to many complications, and it's growing around the world. And now I have a chance to introduce my friend Brian, who will tell his story with Lamanine. And that's why we're so passionate about this product. And that's why we want to share about this product with you and your friends and people they know. So we're sharing information with the entire world. Brian, dear Brian, please open your camera. Inga, please help Brian to open his camera. Yes, he's coming. Hi, Brian. A microphone is not working. This is our first time live webinar together, so we're learning the process. No, we still cannot hear you. Inga, please check. No? Just a second. Oh, something's coming.
Yeah, you had me muted.
Woohoo!
You had me muted.
Yes. Okay.
Here we go. Let me adjust this a little bit.
Okay, Brian, can I show your pictures, the pictures, which I personally done in 2008, after you were released from the hospital.
Right.
And I remember your pictures when you were on chemotherapy. That's picture made of my phone. And you were on so many medications. And then Lamanine came to your life. And tell me the story. Tell everybody your story.
I will. And
Yes.
thank you, Irene. Thank you for having me on. And thank you for the incredible job that you're doing out there, taking this great product out to people and sharing the story and keeping it alive. I mean, you're just an amazing person. So it's wonderful to have somebody like you on a team. It makes it so much easier. And it also makes me look like I'm doing good because you're doing so great. And everybody, you're a dream distributor. Everybody should be so lucky to have somebody like you to work with. And we do. So as far as what happened with me, back when I was diagnosed with liver cancer, it got to the point where I was terminal, and I was just taking all these medications, chemotherapy and whatnot. And, I was in recovery for cancer chemotherapy and the liver transplant, and that's when I heard about Laminine from Adrian Matthews. And at that time I was on major medications, and the last thing I wanted to do was to listen to somebody tell me to take something, another product, because I was taking so many and I was having so many side effects. And so you can imagine what kind of a effect that has on somebody's body. But Laminine is an amazing product. What it does, it elevates the serotonin naturally, and it gives your body all the necessary things that it needs, all the tools that it needs to put itself back into proper balance and restore the right nutritional balance, so your body can do what it's supposed to do, which is put itself into what is called homeostasis, or natural balance, so it works perfectly. Can't do that if it doesn't have all the right ingredients that it needs, and we don't get that from our foods. We just have so much pollution and things that are going on, and then you compound that with an illness, and you have chemotherapy and things. So I was in a terrible state of mind, and physically, mentally, and emotionally. And the one thing that I know about Laminine is it works wonders. I mean, people love it. They typically, when they try it, they want more of it as fast as they can reorder. And, we've keep it in a price point where it's available and easy for people the world over to, obtain this product. But when I started to take Laminine, I did it sort of reluctantly, and I didn't really, give it much of a chance, because I was afraid. I was afraid that if, it would cause reject, because when you're taking liver immunosuppressive medications, you have to be very careful. So I just took one, onesie twosies here and there for, about a month. And interesting, I felt something, but I didn't know what it was. I started to feel a little bit better. And that's when I, called up Adrian again. I says, Adrian, he actually called me and says, how you doing? I go, well, I'm doing okay. He says, how you feeling? I said, I'm feeling better. And at that time, if you can imagine the massive depression that happens to people who are in chemo, and, it was just like anything that I felt was, an improvement. So he asked me, how much are you taking of the product? And I just told him I was taking one. And then he got really mad at me. And he says, you have to take, he said, listen, he says, hey, you dummy. That's how Adrian is. He talks like that. You have to take the right amount, the loading dose, 4 and 4 in the morning. And when I started to do that, within 3 days, everything changed. I started to feel like a normal human being for the first time in many, many years. And, the problem with all of the things that I was taking, with massive doses of all these side effects that were being, I was experiencing from all these drugs, that I had a stroke from one of the drugs I was taking that was going to elevate my, it's called, to the blood red cells. And one of the side effects of that is diabetes, of one of the prednisone rejections. And so my diabetes went into unbelievable numbers, like 600 and 300, and it was just off the chart. And again, right in the middle of all that, then I suffered that stroke. It was called a left frontal lobe cavernova as a result of the medications that I was taking. And so consequently, the trauma and effects of all the major surgery, chemo, the many medications, I was actually taking about 35 medications And that left me in a very depressed state, you know, physically, emotionally, and mentally. And, you know, and it continued until I started to take Laminine. Within just a few days of taking the Laminine, you know, my body started to restore itself. And so Laminine provided my body with you know, the correct balance, and it also gave me the fibroblast growth factors and the things that the body was so depleted of. And I began to feel just like a normal, energetic human being. You know, I've never seen a product do this much, this fast for so many people, and in so many unique ways. And the reason is because, you know, it's not necessarily the Laminine that's doing it, it's your body doing it, because Laminine has given it the resources it needs to function the way it's supposed to. And so that's why Laminine is such a valuable, innovative product. It's very unique. And, you know, you can give this product, and rest assured when you pass it along to people, they're going to appreciate it. They're going to experience something from it. And sometimes people don't even realize what's happening to them. I had somebody who was, you know, the other day I'd given them the product. All of a sudden, the thing that he called me back and he says, I went out and cleaned my garage the other day. And I says, and all of a sudden I'm thinking, oh, why am I doing this? I'm feeling good. And I go, maybe it's the Laminine. And so he connected the dots. It just does make you feel good. That's why we sort of call it the feel good pill. But the one, you know, thing that I'm so fortunate and happy with is that, you know, it has helped to change many people's lives. You know, it's helped us, you and I, and all grow in many, many ways to share this wonderful, beneficial product. And I always tell people, you know, don't share this product with somebody trying to enroll them or to make money. Share it with the good intention that you're going to give them something that's going to help them. And if you do it that way, people are going to experience something, and that nobody wants to be sold anything. So let people get the results that they need, and be the example. Lead by, you know, tell your own story, and share it with people. And you know, we just got an amazing opportunity here to help people in many, many ways. So thank you.
Thank you so much, Brian. It was an amazing story, and I hope my team enjoyed seeing you alive, because many people for many years they heard your story from my conference calls. I always start my trainings, my presentation with your story, because this is how I was involved to LIFEPHARM Global through you, through your result. And I always show those pictures. So everybody's wondering, is Brian still alive? What is he? What he's doing? He is here in front of our eyes, doing well, health-wise and life-wise, right? So he's happy.
Thank you.
Successful. Yes. And I'm so happy that you joined our webinar. Thank you so much, Brian.
And thank you to everybody who's on here. I really appreciate seeing you.
Cool. Very nice. Very nice. And now we want to hear from Dr. Andujar. What is Laminine, and why it does so many good things? And also we want to hear about the studies you've done, Dr. Andujar, because now in this conference room, we have doctors, and they might have questions for you. So, okay, now back to Dr. Andujar. Thank you so much for joining our call.
I'm so happy to be here. I hope you can hear me fine.
Yes.
Okay. Yes. Well, the main study which is being continued is the study that we've done on the pre-diabetic and diabetics. We have done marvelous studies that have continued to go international. In fact, right now, it's also being redone in Kazakhstan. So we have a lot of great information with diabetes. First of all, the study in diabetes was in the 2016 PDR, and it was published there as a dietary supplement. And this new clinical study is the diabetic, pre-diabetic study. what we took was something called hemoglobin A1C. Hemoglobin A1C is now the very common known way that we look at sugar. And so because it looks at a 90-day period, from 0 to 90 days, you'll know what the average sugar is. Now, we took these patients who had 5.7 to 6.4, they were the people who were considered pre-diabetic. And for pre-diabetic, we split them into two groups, Group A, Group B. Group A was a placebo group. Group B was the group that was taking laminine to treat their sugar. Now, there was a third group that was added, which is a group that we actually, they were diabetic, so we gave them laminine to see what would happen as well. All the results were amazing. Group A, placebo, the numbers kept going up, 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 up. So people who were pre-diabetic were starting to become diabetic. They did very bad. They continued to increase their numbers. And with this increase, it brought a tremendous amount of disease. Now the group B, which is the group that took laminine, did fantastic. Their hemoglobin A1C went down, down completely. For all the people in this group, all went down because they were taking laminine. So we actually prevented people who were pre-diabetic from becoming diabetic, which was amazing. Just by taking the laminine, we could stop the process of them becoming diabetic. And then the diabetic group did very well as well. Went down a little bit, but one thing that happened which was amazing was we had this one patient in the group who was on insulin. And by the end of the study, 12 weeks later, their doctor, not me, their doctor took them off of the insulin. Off the insulin. That is amazing. That if you are taking medication, insulin, for the longest time to control your diabetes, you could actually come off of it. It's unheard of for people to come off of insulin, especially some of the pills. So we're actually giving it to people who are diabetic to see if they can get off some of their medication. So they can get off their medication because their sugar is better controlled, all the better, because then they don't have to worry about the side effects of the medication. So with the three groups, placebo, number went up, laminine, those on laminine, number went down. And those who were taking laminine with the diabetic medicine, their numbers went down. So controlling pre-diabetes is very important, because once a person turns diabetic, most of the time they stay there. So we want to stop them from getting there. Now that we have this number, this pre-diabetic number that you can check with your doctor, you check it and take the laminine, and you'll see that it will go down to normal so that you don't need any kind of medication. This study is done so well. It was just a few people that we did it with, but we have now increased it to another group, an Oriental group here in the Los Angeles area. We did the same thing with them, and they're doing well. We have now the group from Kazakhstan. So the whole study is becoming more international. And if we can prove international that if we can lower this, we will continue to do well for so many people to prevent them from becoming diabetic. Thank you.
Oh, thank you so much, dear doctor. It was excellent explanation, and I hope many people enjoy to learn this information because they know someone with diabetes, or they might have diabetes themselves. And now it's time for questions. Okay, if anybody of you, actually we have 35 computers right now. Yes, 35 computers. If anybody of you have question for Dr. Andujar, please click on microphone. I will open microphone and you will have chance to ask all your questions. And I want to also mention that every Tuesday for my group, who's growing internationally, we start to do a live webinar with Dr. Andujar. He's not traveling in April, so next Tuesday we also will see Dr. Andujar. And if you want to hear something on some subject, specific subject, please write down the question, and doctor will always present the way you want to hear about Laminine and all our products that LIFEPHARM Global offered to us. So now the questions, and I see Sylvia has question. Okay, hold it, and I will open your microphone. Hello? Microphone is open.
I'm ready.
Okay. Sylvia, we cannot hear you. Christina. Okay.
Hello, Dr. Andujar. Hello, everybody. I'm calling from, my name is Christina. I'm calling from London, and I'm here with my partner, Jeff. And we've got a question about diabetes. So Jeff is going to ask the question. Thank you.
Sure.
Hello again, Dr. Andujar. Nice to see you again.
Nice to see you.
I have a question about one of our friends who has type 2 diabetes. She's not insulin dependent. She is also suffering with cholesterol and high blood pressure, and she also has a stent, so quite a few complications. She's recently bought a big bottle of Laminine from us, and we would like you to give us a recommendation on how many you think she should take and any other Laminine products that you think would be beneficial to her.
Well, initially, you definitely need Laminine, and you take 2 twice a day, 2 in the morning, 2 at night. Depending on how high their blood sugar number is, you may even need more. So, assuming that controls it, you also need to add omega. Omega will help with the high blood pressure and cholesterol. So I would take 2 of the omega in the morning, 2 of the omega in the evening. So both of them 2 and 2, and then to balance things out, you would take a single, 1 digestive once a day and 1 immune once a day. Because the patient having a stent will be immunocompromised. So we want to make sure that we stabilize the immune system as well as the digestive system. So in total, it's 2 Laminine twice a day, 2 omega twice a day, 1 digestive and 1 immune once a day.
Okay. Thank you very much.
Thank you very much.
You're welcome. And you can see that we also have up there the email where you can write to me directly, and I will answer you any questions that we don't get to today.
Thank you. Thank you very much.
Cool.
Okay, thank you so much. I don't see more questions, and I know from last call, many people wants to talk to Dr. Andujar. We don't have much time because our next call starts in 40 minutes. So please, everybody with the questions, click on microphone and I will open. I need to see the list of everybody who wants to ask questions. Okay, Sylvia?
Hello, can you hear me?
Yes, hello, Sylvia. What country are you from?
I'm based in Scotland, in Edinburgh at the moment. So,
Yeah,
okay.
Scotland.
Am I being heard? Because I can't hear myself.
A little bit louder, please.
Louder. Okay, I'll try to shout. Okay, thanks, doctor. I refer to the question which was asked also last week, and thanks, Jeff, for actually asking the question. It's about a person about this after a stroke, ischemic stroke and the thrombotic one, and you advised to actually administer like 2-laminin and 2-omega, well, and the person is being fed by this PEG, so this, well, the tube to the stomach. And my question is, if the person was diagnosed with diabetic condition as well, would that somehow influence the dosage, or would it still be 2-laminin and 2-omega? That's one question. And the other thing is, as for omega, because we never tried it, is it possible to squeeze it into the tube, or do you need to dissolve it because it's a hard tablet? That's another question.
You should, first of all, just try to squeeze it to the tube. That should be fine. And then the initial question concerning the laminine, I would increase it to 3 twice a day because of the balance necessary to make sure that you get enough to cover the sugar problem. It all depends on how bad the sugar problems are. And since he's laying down and can't exercise, I would suggest that you take 3 twice a day.
Plus 2 omega ones twice a day.
Yes, and try to squeeze them into the tube as much as you can.
Okay, thank you very much for your assistance.
You're welcome.
Hey, Joseph. Joseph?
Hello.
Yes,
Hello.
hello, dear.
Can I ask a question about high blood pressure? My
Sure.
brother has got high blood pressure, and I was wondering what the studies were regarding that, because he's very much into scientific information about it.
Well, I would suggest, I had the same problem having, both my parents had high blood pressure, high diabetes, and high problems. So with what I do is I take 2 omega a day with the 2 laminine twice a day. But I also add some extra coenzyme Q10 because that is the product in omega which helps drop the blood pressure. So since it does, once again I take 2 laminine twice a day, 2 omega twice a day, and I take the coenzyme Q10 separately. I buy it separately and I take it twice a day as well. That helps with lowering blood pressure and keeping the blood pressure down.
Right, where do you get the Q10 from?
Any natural food store. I mean, in America they sell them everywhere, in CVS, any pharmaceutical. But you may have to go to a natural food store in your particular area.
There is toppings, you know, for breakfast, you know, that's got Q10 in it. In my local health food store, it's like it's just a dry dry topping for porridge or something like that.
All right, well that should be good. It's coenzyme Q10. As long as it's coenzyme Q10, it will help with the blood pressure.
Thanks very much.
You're welcome.
Welcome. Thank you so much, Joseph. And I'm showing the website which has been created by LifePharm Global, and you can see homepage, and you can see if you click on any of the products like laminine, omega, which I did, and you can see all the studies which have been done by Dr. ANDUJAR for all of us. So you can read it, download it to your computer, and also share with the people. Okay, the next person, Marla. Hello. Hello, Marla.
Hello.
Hello.
I believe you're in Mexico, right?
Yes, my name is Marilla, and I call from Mexico. Thank you very much for this presentation. I appreciate very much, and I partially gave the response for my one question which I had, because I had a controversial or maybe say a different opinion about taking laminine and omega together for the people with high blood pressure and taking the pills for thinning the blood. But now I see that that is absolutely safe and it's not a problem. Because I heard that the people with high blood pressure and taking the pills for thinning blood, they should not take laminine with omega. Well, laminine alone without omega. But I have another question. I have a question about macular degeneration. If Dr. Andujar have an experience about this, and how to help the people with this kind of problem.
Well, I have quite a bit of experience, actually. I have to tell you a quick story. I went to Mexico to check out at this clinic that was doing stem cell shots. They would take shots directly from the tibia, the big bone in your leg, and they would use the blood in there to inject then into the eyeball for somebody who had macular degeneration. And it was amazing. From one day to the next, they went from 2200 to 2020 normal vision in just one injection. So not to make a long story short, now it's very expensive to do these types of things. So we have the fibroblast growth factor, which takes our adult stem cells and activates them. So this is something that is very similar. They could activate the adult stem cell to help with the amino acids and proteins to make it normal. So I would consider taking the laminine like the effect on the adult stem cells. So I would recommend that they take severe macular degeneration, 3 laminine twice a day with 2 omega twice a day, and 1 digestive and 1 immune. That combination should help, maybe help, has helped numerous people with laminine. Excuse me. So the total would be 3 laminine twice a day, 2 omega twice a day, 1 digestive, and 1 immune.
This is in several situations, but when it's something, when somebody is not, when the problem is not so heavy, it's a beginning, for example, of the macular degeneration. Can it be a little bit, the dose should be a little bit lower?
Yes, I would start at 2 twice a day.
2 twice a day, 2 laminine and 2 omega and 1 digestive and 1 immune, yes?
Yes.
Okay, perfect. And I have another question, if I can. I would like to ask about about the problem with hearing. It's about the person who lost the hearing in one ear because of the virus, and the virus entered into the ear and destroyed the cells from the interior ear, and this person cannot hear. It's 70% loss of the hearing. The medicine, conventional medicine says it's these cells are dead, but maybe laminine could be helpful in this case. I would like to ask doctor, if you have an experience in this kind of cases.
Yes, we've had a lot of experience with it's called the cochlea, the round part, round bone in the ear, and the hearing gets unbalanced. What laminine does best is to balance things normally, and it balances the hearing much better if taken. Again, should be taken twice a day to make sure that you have to, I keep on saying twice a day because these pills are 12-hour pills. So after 12 hours, they don't work anymore. So that's why you have to take them twice a day. But for the hearing of the cochlea, I would start off with 2 twice a day, with omega 1 twice a day.
Okay, 2 in the morning, 2 in the evening, and omega 1 in the morning and 1 in the evening, yes?
Yes, yes.
Okay, that's great.
So, since you're from Mexico, afterwards, if you would write to me, it would be good because we are starting to do some work with getting the registration in Mexico. So I want to keep you on time with everything that's going on there. We have new people here. One gentleman who's from Mexico, who's working with us to develop the Spanish countries.
Thank you. Of course I will.
Thank you.
Thank you very much for the answer. I think it will be helpful, and see you next time.
I'll see you next time.
Okay, so thank you so much, everybody. I don't see any questions. I don't see any hands. So I just want to say, Brian, you can open your camera. And yes, thank you for being on the call with us. So next Tuesday, please invite more people to this conference room. You can share your stories. Dr. Andujar will talk more about Lemonine, more details on this amazing product and other products. So we can help so many people to stay healthy. Yes, immune, I need to take immune, yes. All the products, all 4 products. This is our powerhouse pack. And why do you think Dr. Andujar looks so great? Because he takes all 4 products. Why Brian looks so great after so many illnesses and conditions? Because he takes 4 products. Why I am in my 60s look so good and feel so good? Because I've been taking all the products all those years that they were launched and being available for us. So thank you so much again. I see someone's...
Irene, I just want to say one final thing before we go, just to complete the thought process on diabetes. Since I've been taking Lemonine, my blood sugars have been normal for the last 5 years.
Wow. And by the way, the video that I showed, that was video of my papa, of my father, and you can see his results from 500, 350 to 126, and my papa 87 years old. Thank you so much, everybody. Brian, Dr. Andujar, and everybody who visit us and stay with us and invite guests to hear this amazing information. So everybody, bye-bye. So we'll see you next week.
Thank you.